And now on the line is Sheila Gilheany. Sheila is the CEO of Alcohol Action Ireland, and Sheila is talking to me today in that capacity and also in the capacity as a spokesperson of the Health Promotion Alliance Ireland. Sheila, welcome back to Nair FM.
Thanks very much, Darren, for having me on.
Okay, Sheila, can you start off by telling me about who the Health Promotion Alliance are?
Surely. So this is an alliance which has brought together a number of organisations across the health sphere, both in Ireland and in Northern Ireland. And it's actually been organised through the Irish Heart Foundation. And the principal goal of the alliance is to emphasise what's needed in terms of the prevention of chronic disease and illness here in Ireland. So it's really pointing towards what we need to do to prevent people getting ill in the first place. Not so much about what we do with people when they are sick, and treatments and things like that, but how can we actually stop people getting sick in the first place? So there's quite a number of different organisations involved in that. There's people who be working, say, in cancer treatment, in heart, lung illnesses, in asthma, kidney diseases, and then there's people like ourselves, who would be coming at it from the alcohol side of things, because we know that alcohol is responsible for around 1,500 deaths a year, and most of those deaths actually are occurring from illnesses such as liver disease, from cancer. And we know that one of the very effective things that can be done to stop people getting sick in the first place is to have controls around the drivers of illness. And those drivers are smoking, alcohol, unhealthy foods, and lack of exercise. So particularly, I think, when we're talking about those unhealthy commodities, one of the things that has become very clear over the last number of years is that there really needs to be control on the marketing, on the availability, and I suppose on the price of those of those commodities. These are very large industries which are very powerful, and they form, I suppose, part of a kind of an ecosystem around what determines our health. So one of the things that we've been talking about recently is what you would call the commercial determinants of health. And we know that there are forces here, from these very large businesses which do drive our health. As I say, one of the things that is very clear to us from an alcohol perspective is that we could reduce the level of illness in Ireland by reducing the levels of alcohol consumption.
Okay, I understand that the Alliance was only set up recently and that you and your colleagues in the Alliance made a presentation in Leinister House on Wednesday, just gone the 14th. Can you tell me a bit more about your presentation, Sheila?
Sure. So this was to the Health Committee, the Oireachtas Health Committee, and it was very much about the commercial determinants of health. So we're used, as I say, to thinking in terms of health as being, what treatments are available, what more can be put into hospitals, are there new drugs available and stuff like this. But this is very much putting it to the committee that they really need to be looking at these commercial determinants of health, because it is, firstly, prevention is literally better than cure, but also because our hospitals we don't have enough capacity, and we will never really have enough capacity to be able to deal properly with the levels of illness that we have. We have an ageing population. We know that the pressures that are on that. So what we were saying to the committee is what's needed here now is a prevention strategy. And to date, when there has been discussions about prevention strategy, it has kind of been focused on I suppose trying to drive individual behaviour change. It's been, about educating, telling people about, need to have at least 5 fruit and vegetables a day. Those sorts of things which are true and which are useful, but which really are not effective in actually driving change. The things that we know that really drive change are controls on these industries that do promote these very unhealthy products.
Okay, the speakers in Leinister House on Wednesday, including yourself, Sheila, seem to me, from reading up on them, to come from very interesting and very relevant backgrounds for this topic. Can you tell me a bit more about the other speakers in Leinister House on Wednesday, Sheila?
So I was there, but also Janice Morrissey, who is the chair actually of the Alliance and has very much been the driving force behind that. She would look after advocacy work within the Irish Heart Foundation. We were also joined by Lizzie Sullivan, Dr. Lizzie Sullivan, who's from Technological University of Dublin and who would be a specialist in nutrition. So again, there was a lot of expertise that had been gathered there from within the Alliance, but we were also joined by a colleague from Trinity College Dublin, Dr. Nora Campbell, who's an expert in marketing and particularly, looking at the marketing of unhealthy foods. So there was a lot of expertise gathered in the room. There's these people who have been working, have been researching, and have really been looking into, I suppose, what we can see works and what we can see works in other countries. So it was really great to have that level of expertise actually, gathered together and to be able to answer the questions of the committee members.
And is the situation any better in some other countries, do you think, Sheila?
Oh, absolutely. I mean, one example that we were pointing to was Norway. And, Norway drinks about 37% less per capita than we do in Ireland. We were making the point that, people living in Norway are not that different from people living in Ireland. What is different is, I suppose, the conditions in which they're living there. So in Norway, there's a complete ban on alcohol advertisement. There are high prices for alcohol and there's limited availability. Now, it is available. I'm not saying there's by no means, there's certainly not a prohibition or anything at all like that. But to buy alcohol from an off license, the hours in which those shops are open is shorter than would be here. They tend to close, I think, around 7 p.m. But as well as that, the government there actually control the sale of alcohol through a monopoly system. So there's just such a difference between attitudes really around the need for controls and they see the benefit of that. So we were pointing to that. There are other countries as well. Lithuania has been another very good example, which in recent years it used to have one of the highest levels of death from alcohol, but between 2010 and 2016, it has actually seen a drop of 20% in terms of those deaths and years lost from people dying from alcohol. And the reason that they have seen that 20% drop is again because a complete ban on alcohol advertising, increases in taxation, and some increased controls on the availability of alcohol. So, we can point to the things that work. And the other thing that to me is very interesting about this, these are low cost solutions. Very often when we're talking about a problem and we look for a solution, there's a heavy cost with it and you have to go, right, how are we going to pay for that and what else has to give to be able to do this? But these are low cost solutions. These don't cost, they're very low cost really to government at all. What it takes is political will to actually do it. And I think that's important to note here is that the public are ahead, I think, of politicians on that. We know that there's very strong support for controls on alcohol advertising, just as an example. And there would be similar things about junk food advertising as well. But at least 70% of the population favour a reduction in the level of marketing of these unhealthy products. So what's stopping politicians actually grasping this nettle? We would say that's probably really due to the influence, the very, very strong influence of these powerful industries around that. And we talked about that at the committee, that for a start-off, there needs to be a lot more clarity about the level of lobbying that actually goes on. But I think as well, there really needs to be, and we discussed this, there needs to be a framework for how government across all departments, how they interact with these industries. Because at the moment what we can see is an awful lot of policy incoherence is really what I would say. So you have the Department of Health, for example, who are looking to reduce alcohol consumption. And then you have the Department of Justice who are actually seeking to increase it by increasing alcohol availability. But as well as that, we would see that the alcohol industry really goes all out to try and insert itself into policy making in all sorts of areas. So we were pointing, for example, that there was a new strategy produced by the government around sustainable food development. It's called Food Vision 2030. And the chair of Diageo in Ireland, the major drinks company, managed to have a seat at the table in the production of that strategy. Now, for a start off, alcohol is not a food, so why on earth were they there in the first place? Second of all, alcohol in itself is a barrier to 14 out of the United Nations 17 Sustainable Development Goals. So it's absolutely not a thing. And what we see from that is that this is an industry that's very good at being able to have access to government at the highest level and inserting themselves as policy makers. And that is a very concerning thing. We were pointing to that particular example during the meeting.
Okay, I believe as well that Hildegard Naughton, the Minister of State in the Department of Health, was also there on Wednesday. This might be a big question, Sheila, but can you tell me, bearing in mind that we're going to have elections this year, can you tell me if you are confident that anything lasting by way of Oireachtas changes or legislation is going to come of your work with the Alliance?
Well, we were very pleased to see that Deputy Roisin Shortall asked the Minister a very direct question where she asked, would you produce a report or would you commission a report which would look at the commercial determinants of health in Ireland? Now, the Minister said she would consider it, and that's definitely something we would want to follow up on, because I think, when you have information, it'll help guide what happens next. We were also pointing to, what's called the Healthy Ireland Framework. And the whole idea in the Healthy Ireland Framework, which was launched a number of years ago, was that there should be health in all policies across government. Now, that policy is due to come, that framework is coming to an end next year. And we were asking for a review of that, because what seems clear to us is that while the intention was there at the beginning, that it hasn't been followed through. And we were asking that Minister Hildegard Naughton would, look carefully at what has come out of Healthy Ireland Framework and really see what needs to be adjusted. And what we would be saying here, what has to be adjusted is a complete paradigm change, where we move away from trying to encourage people, through education, eat more vegetables, drink less alcohol, to actually changing the environment in which people find themselves. Because it's all very well exhorting people, saying, drink a bit less, with an occasional alcohol advertisement that you might hear on the radio, when people at the same time are being bombarded with saturation levels of alcohol advertising. We gave a comparison that in 2021, just as an example, people were exposed to about 115 million euros worth of alcohol advertising, compared with the HSE alcohol programme, and they're asked about alcohol budget for communication, was of the order of 65,000. So 115 million from an alcohol ads versus an education programme of 65,000. Now, it doesn't seem realistic to me that we would ever be able to match the alcohol advertising budget. So what needs to happen is actually to reduce the level of alcohol advertising. That would be a much more instructive and a much more cost-effective way of approaching the problem.
There are big changes, I believe, planned over alcohol advertising on television next year, aren't there?
Yes. So from January 2025, there will be restrictions on alcohol advertising through a broadcast watershed, which is very welcome. But what we would be saying is the legislation for that was passed in 2018. Why is it taken 7 years for it actually to come into effect? And we also know that, unfortunately, while it's a useful thing, people watch a lot less TV nowadays, and they watch a lot more online, and we don't see this a similar level of restriction around alcohol advertising online. Now, Commission Naman which is a newly established body for online regulation, is coming up with codes around this, and it should include work on alcohol advertising, and children shouldn't be targeted. But it's very slow, the progress on this. And meantime, the industry is just racing ahead on this. Now, another important provision within the Public Health Alcohol Act was restrictions on the content of alcohol advertising, and there's no timeline at all for when we might expect to actually see those regulations coming in place. So what is clear is that you have some modest measures. They're very slow to be implemented. They're even slower to be evaluated or to be looked at. And the industry is just racing ahead. And they set the agenda. And what we're saying is that if we want to really reduce, harm from unhealthy foods, from products like alcohol, we have to tackle them, and we have to tackle them bravely, and really say, who's going to be picking up the cost of all of this? Should it be the taxpayer? Is it these unhealthy industries? Why can't we just curb their activities and make sure that we're not actually, making our population sick?
Okay, Sheila, it's great talking to you today again. Near FM was only talking to you on this program a few weeks ago. Before you go, can you tell me if you have any more big plans or work planned with the Alliance and with your organisation Alcohol Action Ireland over the rest of the year, bearing in mind as well that this year is a very big year for elections?
Absolutely, it is. So I will say that the Alliance is just getting going. We are drawing up a programme of work, but I think the election, the elections that are coming would be important. From our perspective in Alcohol Action Ireland, what we will be seeking is commitment from political parties to include in their party manifestos the need for an office for alcohol harm reduction, because we see at the moment there is such a lack of alcohol policy development, in government. And that comes down to a lack of resources within the Department of Health. So we're really pressing for that as an essential thing that we would want to see commitments from all political parties on that.